I want to welcome everybody to Healthy Seminars. I'm your host, Lauren Brown, your moderator. We also have Sandra Grassa and Laura Ann Slowenwhite as our moderators. And our speaker today is Shellie Goldstein, and we're going to be talking about some cosmetic acupuncture. And so I'm very excited to have Shellie back at the Healthy Seminars family and to offer this presentation for all of us. I do want to just do a little bit of housekeeping and share with you a few things because some of you may want to see the replay and just know about more of these free events. So on the Healthy page, there's a resource link on all the pages, and this is the resource page. You can see our logo there, Community, Unity, Immunity. And below that, we have a calendar of events each month that you can see what's happening. I do want to share with you just a little bit about the Community, Unity, Immunity. This started in late March of 2020 when COVID caused a lot of shutdowns of acupuncture clinics, and we wanted to keep the connection going. So although we were having physical isolation, we didn't think we should have social isolation because that's what they were calling it, right? Social isolation. And so we just started having almost daily lectures. And we thought if we can turn on our mics, because back then most of the webinars, the speaker mic's on, but you guys had your cameras and mics off. So we just wanted to see each other, a way to connect. And we just thought rather than stressing out, because we were doing a good job at that with the media, et cetera, let's spend a couple of hours a day together where we can see each other and connect and also be proactive and learn stuff that's going to make us better practitioners, better human beings, and take that into our community. And we continue to do that. And we plan to continue to do that, just not daily anymore, our Community, Unity, Immunity series. And so we're always adding stuff on this. So just keep checking back because we usually will put them up when they're a week or 2 weeks away. So keep being added. And I want to let you know that below that calendar is where you'll find some of the replays. So right now, here's where people can join as we're getting ready to, we're streaming here with Shellie, but we're going to put the replay up here for about 48 hours and then it will go into our archive library. But if you want to see this or you missed one and you know it was recent, this is where you would go and find the replay. As you can see, we have one here from Laura Deshar, for example. Her replay is still up, about to come down. So just want to let you know that's where you find that. I also want to let you know that we have a disclaimer for today. We always just want to remind you that everything is for educational purposes here, educational and entertainment. And if you have a health condition, then please seek out a healthcare provider. This is for educational purposes. It should not be intended as medical advice. Seek out a healthcare provider. And then Shellie does have a class on Healthy Seminars called Computer Screen Exposure. We got her to record this because she's famous for the face, right? Shellie is known for the face whisperer. She's got books on this. She teaches extensively on this, but she works with a lot of stuff. She's a wizard with the needle, and especially when things come up from the neck up to the face. And Shellie and I were talking, like, we're all got this like Zoom fatigue, our body, our neck hurts. And so she put together an excellent lecture on techniques and stuff that we can use from our profession to support our patients who are so much on the computer these days. So I just want to let you know about Shellie's stuff on our Healthy Seminars. All right, Shellie, without any further ado, let's get your PowerPoint up. And again, we're going to talk about cosmetic acupuncture today. You are welcome to post in the chat room questions. I'll moderate those to Shellie. At the end, we'll give you your mic right so you can even ask questions of Shellie at the end of this lecture. We love it that you have your video on, and this is, you guys can post and say hi to each other in chat. This is about community while we learn together. So without further ado, I give you my colleague and my friend, Shellie Goldstein.
Fantastic. Thank you. Thank you so much. And it's really a pleasure to be here. It's always fun to work with you, Lauren, and to work with Healthy Seminars. So today we are going to talk about cosmetic facial acupuncture, and we are going to look at this from a little bit of a different approach. We're going to look at it from the perspective of a biomedical and Eastern medicine perspective. So we have several learning objectives for today. We are going to discuss facial acupuncture and aging from a traditional Eastern Asian medicine approach, which I call TEAM. We're going to look at it from the channel theory perspective. We're going to discuss facial aging from a biomedical perspective. And then we're going to pull it all together. We're going to talk about the TEAM diagnostics and treatment for improving the visible and systemic signs of aging. So we think of cosmetic facial acupuncture as a modern system, but in fact, that's not the case at all. It actually stems from Mai Rung. Mai Rung means beautiful appearance, and it's a holistic regime practiced throughout Asia for centuries. It was designed to promote systemic health and well-being and delay the visible signs of aging. It was distributed in the form of either acupuncture or herbs, either topically applied or ingested. And so the story goes, it was used by emperors to keep their concubines looking beautiful and healthy, and by the empresses to maintain a youthful, radiant appearance. However, I am pretty sure that there were variations of Mai Rung regimes utilized in most households throughout Asia. When I started practicing in 1991 in the state of New York, and we all know that acupuncture is regulated state by state, and in New York, we had one of the oldest acupuncture laws, and that also meant it was one of the most archaic laws. So 6 days before I graduated, and there was a freeze on all licensing in the state of New York until they rewrote the law, and it took a year and a half. So I took the opportunity to go to China and studied in a hospital in Beijing and was placed in the facial acupuncture unit. I had no idea what I was going to be specializing in, but I learned a lot about faces, and I learned a lot about acupuncture for treating different facial conditions. Came back, and ironically, when I did get licensed, people started coming to me for their face. They wanted me to know if I could help them look younger. And at the time, I was younger, and so I was like, okay, I don't really care that much about it. But then one day soon after, I did. So I have a master's degree in biology and nutrition. I'm licensed in aesthetics, and I also have an acupuncture license. So I put it all together, and I came up with a regime, and it was a little bit lonely because not many people know about it until this article came out in the New York Times in 2006. How to lift your face with 2 hands, 30 needles, and no knives. And it was basically talking about acupuncture as an alternative to Botox, volumizers, and surgery. It mainly said that the celebrities are starting to get it. If celebrities start to get it, then everybody else does too. So it was that was a door opener for me. However, the first landmark study in facial acupuncture was in 1996, and it posted in 2018, and it was 300 cases treated in China with cosmetic facial acupuncture. And based on the results of this article in the International Journal of Clinical Acupuncture, they said that 90% of the people treated had a marked effect with one course of 10 treatments. Well, that was pretty amazing. It said that the benefits demonstrated improvements in skin texture, skin color, skin elasticity, wrinkle reduction, and overall rejuvenation. So I was really motivated by that. Additionally, it said that the results were not merely confined to the face, as cosmetic acupuncture virtually always includes work to address the entire body and organ system as well as the face. Aha. This is our Chinese medicine. So we are not just treating the face, but we are treating the entire body. So it takes a whole systems approach towards aging and diminishing the signs and symptoms of aging by supporting the underlying foundation. Does this sound familiar? So even when the complaints are wrinkles and other facial concerns, we're really treating the underlying conditions. And that's because from our team approach, where the condition of one's face and their skin is directly related to their internal health and well-being. So we're not just working on the face. we are looking and considering and addressing the multiple energetic meridian pathways and their associated organ systems, treating those underlying imbalances, no matter what they are, whether it's digestion, pain, stress, menstrual or reproductive disorders. And we say that the underlying patterns of disharmony are the root cause, and the symptoms are the facial concerns of our patients. So facial concerns, wrinkles, sagging skin, muscle tone, skin discoloration, et cetera, they're really just the symptoms of the underlying pattern of disharmony. So in our medicine, we treat the root cause or the root pattern of disharmony with body points and the branch with face points. The branch being the wrinkles, skin sagging, muscle tone, or whatever our patients are coming in with. We can use acupuncture points, we can use motor points, we can use other points too that we're about to find out. And this point selection can either be on the meridians and associated channels are off. And a lot of that depends upon this. I really, really believe that effective results reside in the understanding the relationship between team, biomedical anatomy, and the morphological alterations over time. That's why I think it's so, so important to really understand your facial anatomy, because when you understand what's going on, if you reflect the surface skin off and see what's going on underneath, your treatment skills will significantly improve. So let's go over those. When we think about the aging face from a biomedical perspective, we're going to divide the face into 3 layers. The upper third is the forehead area, and it ends just below the eyes. The middle third is from just below the eyes to below the nose. And the lower third is from the lips down to the chin area. Now, when we are in our youthful years, the focus are the wide, if you put a triangle in the middle to the lower aspect of the face, the base of that triangle should go up at the cheekbone. So you should have high lifted cheekbones and a more pointed sculpted chin area. As we age, that begins to shift. Call it gravity, call it whatever. The weight of the face moves downward so that the base of the triangle actually now lands at the jaw area with a flatter, deflated midface. So it looks like this. Clinically, what we begin to see is not only does the weight of the face shift down to the jaw area, but it also gets pushed medially. So we start to see creasing across the forehead, between the eyebrows, puffiness or creasing under the eye, creasing between the nose and the mouth, that's the nasolabial fold, creasing around the mouth, along the chin area, loss of definition along the jaw area, and creping in the neck. And it's due to a number of factors. It can be due to skeletal tissue changes or soft tissue. So let's start at the deep area. Let's start at the bone, and let's make our way up to the surface and look at the changes that occur. This is a CT image of a female on the left from 20 to 40 years old, and on the right, she's somewhere over 65. There is a visible difference between what happens to the skull from a youthful age to an older age. As we age, a couple of things happen. The actual height of the face starts to decrease. The eye sockets, remember, bone is being eaten away, it's being reabsorbed. So it occurs from the openings out. So the eye sockets are going to get a little wider. The nasal piriform, the nose, gets a little wider. There's hollowing in the temporal area. There's resorption of the mandible and the maxilla, the jaw and the cheek area. When that face starts to push forward, it actually changes the shape of your teeth. And additionally, what happens is the jaw actually, or the entire face, starts to rotate forward and down and around. So this is what happens. Take a look. Here's the skull, an aging skull, the dark areas where the bone has been resorbed, and look at the tissue changes that occur just from the skeleton being remodeled. So you can see there's a significant change that begins to happen. From a tissue layer, the tissues from this that we're talking about, from the deep to the more superficial layer, includes muscle, the fascia, deep and superficial fascia, the subcutaneous or the fat area or adipose tissue, the skin, which includes the dermis and the epidermis. And then these soft tissue layers run in a horizontal plane. And then there are retaining ligaments, which are like little plugs that hold this tissue together. So here's a drawing. The black on the bottom, this is bone. Fascia, there's two types of fascia on the face. There's deep fascia and superficial fascia. Deep fascia, we'll learn about both of them. This is muscle. And then above this yellow layer is the subcutaneous or the adipose layer. And then there are two layers of top. It's the dermis and the epidermis. And then you can see the retaining ligaments, which are the plugs that hold everything together. So let's look at these. Face muscles are unique. They're different than the muscles of the rest of the body. Face muscles are designed to move, body muscles are designed to move bone. So for example, if you flex your arm, what happens? The lower bones lift up. If you relax your biceps, it goes down. Muscles of the face, they're deep muscles and the mimetic muscles. Mimetic means muscles of expression. They function differently than the rest of the muscles of the rest of the body because rather than moving bone, their attachments are not bone to bone, but rather bone to muscle, muscle to muscle, and muscle to skin. So rather than moving bone, they're going to move muscle and skin. Here they are. You can take a look at them. They're very, very flat, very thin, striated skeletal muscles innervated by the facial nerve. And again, you can see this muscle is the orbicularis oculi. It's the muscle that surrounds the eye. It is deeply connected with the frontalis muscles, the muscles across the forehead, the muscles of the cheek. And the muscles of the cheek are connected to this muscle. This is the zygomatic muscle or your smile muscle, which is intimately connected to the orbicularis oris, the muscles around the mouth, and the other cheek muscles. So you can see that rather than being attached to a bone and moving bone, they in fact are going to move the muscles of the face. And what happens when we move the muscles of the face and we move the muscles of the skin? Those are your muscles of expression. They create the expression. All of the expressions that we make in our face are created from the mimetic muscles. With age, rather than them getting weak because they are moving all the time, we say they attenuate. So attenuate means two things. It means the force of the contraction is less, but it also means the ability for them to create large expressive movements changes. So they get straighter, stiffer, and you get a reduced amplitude of movement. So if you look at someone who is older, although they may be equally expressive as someone is younger, they are not going to experience, you won't see that expression on their face because those muscles are straighter, stiffer, and the amplitude is changed. So it leads to this appearance of kind of a frozen movement. And when that happens, you get deeper wrinkles increasing on the face. Not only that, but there are two types of fascia. These are muscles. So there is deep fascia, and deep fascia surrounds and isolates and protects the deeper muscles. But then there's this layer, tiny, tiny layer of fascia called superficial fascia. And that is designed to actually connect muscles to the superficial layers of the skin. So deep fascia is designed to support and protect those deeper muscle groups and vessels, whereas the superficial fascia or the superficial musculoaponeurotic system, the SMAS layer, is a superficial fascial complex that it's located from the middle to the lower third of the face, and its job is actually to increase the mimetic muscle amplitude and volume so that it heightens the activity of all of our facial expressions. As we age, the ability, similar to the muscles, the elastic and contractile quality of those fascia, which is so important for healthy tissue function, becomes dry and rigid as well. So this is fascia. This is healthy fascia. And then we're now going to move into a cadaver. So let's respect the cadaver. But A is the superficial fascia. You can actually see the difference between it. And B is the deeper fascia, which is deep, deep into the tissue area. On top of the muscles, on top of the deeper and superficial fascia, we have the subcutaneous layer. That's our fat. So fat is designed to provide the facial volume and stability of the face. And we think that fat may be just this blanket layer of fat across your face, but in fact, that's not the case. It's actually divided and compartmentalized into pockets. So as we can see in a younger person, nice, healthy, thick pockets of fascia. As we age, we say that that fascia begins to deflate and descend. So you can see it's starting to break up. You can see more pocketing and breaking down of the fat tissue. And then you can also see it descending into areas. So the one place that it actually descends is to that nasolabial fold, the fold between the nose and the mouth, and then along the jawline. It also goes underneath the eye. So what the importance of this is when you're treating someone, you need to know whether you're treating water. So they come in with puffiness under the eyes. You need to know whether you're treating water or fat. It's much easier to treat water than it is to treat fat. If it's fat, you're going to have a harder time clearing the congestion. And the one way to know the difference is if you have your patient keep a stationary facial profile and have them look up and look down and look up and look down. If that pocket moves, it's water. If it stays stationary, then it's fat. So again, it's easier to clear water congestion than to fat. Also, this little lump that you often see along the jawline, that's not just lack of muscle tone or water, it's fat. And again, so realistically, it's going to be a little bit more challenging to treat and clear fat than it is to clear water. On top of the fat is skin. So there are two layers of skin. There's the dermis, and then there's the epidermis. So the epidermis is what you see when you look in the mirror or when you look at other people. The dermis is what's underneath. And the true health of your skin is that dermal layer. So healthy cells start at the base between the fat cells and the dermal layer, and they float up into this very aqueous solution of hyaluronic acid and water. In this area, there are a lot of nutrients. There's collagen, there's elastin to maintain the elasticity of it, a lot of proteins and vascularization. So the healthy cells grow into nice, healthy, plump cells. As they start to move up to the surface, they lose their water content and they start to flatten out and dry. And by the time they get to the top, they die, they get sloughed off, and these new layers of healthy cells come up to the surface. As we start to age, you can see visible changes in these two layers. First of all, you start losing the vascular tissue starts to diminish. The organization of collagen and elastin fibers start to change. And when that happens, there's a decrease in the cell health. Though all of these cells that are floating up to the surface, they slow down. They don't turn over as quickly. The layering between the dermis and the epidermis starts to thin and get separate. Elderly people have very thin skin, which creates dryness in the upper layers and the epidermal layers of tissue. And you start to lose plumpness in the area, less suppleness, less plumpness. And when that happens, it's kind of like a mattress that you lay on for year after year after year after year. If you're in the same place, you start seeing a little pitting in the mattress, and the same thing happens in your skin. And then we have those retaining ligaments, the retaining ligaments that run in the vertical plane and stabilize the position. So they're going to stabilize all of those horizontal planes. Well, what happens when they start to age? Not only is the tissue moving, but those retaining ligaments or the plugs are aging as well. They too start to lose they attenuate, so they get shorter and stiffer. They decrease in their interfacicular lubrication, means they dry and they start to move too. So everything starts to move down and medially towards the medial portion of the face and the lower portion of the face. And when that happens, all of the deep folds, wrinkles, jowling, and loss of malar projection become exacerbated. So you can see that not only is aging a concern of health, internal health from our Eastern, our team perspective, but you need to also take in consideration what's going on a physical level and in the structure and the morphology of the face. So we know from our research that acupuncture targets osteoblast proliferation and differentiation by stimulating mesenchymal stem cell precursors. It helps to grow bone. We also know that acupuncture has a positive effect on muscles. Acupuncture, when you apply the needles in and you stimulate the needles, it's going to downregulate genes involved in muscle breakdown. And it's also going to upregulate protein synthesis. And it also restores resting mimetic muscle tone. So the mimetic muscles being those muscles of expression of the face, it's going to restore their tone, keep them nice and healthy and lubricated. When you insert a needle into the tissue, just the mere act of inserting the needle through the skin creates a natural wound healing cascade to release the growth factors and stimulate the production and deposition of collagen and elastin in the dermis. So it's going to help keep the skin plump and keep the volume nice and thick and healthy. And also we know that acupuncture enhances facial elasticity. So the collagen and the elastin that starts to break down as we age, acupuncture helps to maintain the integrity of collagen and elastin. So what's nice about this, and we're going to start to transition into what do we do with all of this information that we just got, is when you specialize in a field, you tend to get a certain subset of symptoms. Well, with facial acupuncture and cosmetic facial acupuncture, your patients will come in complaining or with concerns of wrinkling across the forehead, between the brows and around the eyes, eyelid ptosis, which is the lidding above the eyes, the eyelid starts to droop, puffiness or darkness under the eyes, wrinkling in the cheek area, sagging of skin and muscle in the cheek area, and that hyper exacerbation of that fold between the nose and the mouth, the nasolabial fold. Around the mouth and the jawline, people will start to experience wrinkling around, above and below, and around the mouth. Marionette lines, those are the lines between the corner of the mouth and the jawline. The mental crease is a little crease that occurs below the lips and above the chin, and loss of definition along the jaw. Along the neck, people will complain of skin sagging, platysma banding, and then they'll just say that their complexion is dull or dry, hyperpigmentation, sunspots, rosacea, acne, and they'll say they just look and they feel old. Well, they're going to come in, they're going to tell you what's wrong, and then the first thing they're going to want to know is, what can you do for me? What results will I get? How long will it take? And how long will it last? And so this is really important in terms of understanding the morphology, the biomedical morphology, and the team approach, so that we can give them a realistic idea about what's going on, what we can achieve, how long will it take, and how long will those results last. Now, these are kind of the superficial questions. There are other questions as well. So we can comfortably tell them that externally we can soften their deep wrinkles, we can help to eliminate their small fine lines, we can help to improve their muscle integrity, we can correct and heal skin problems, we can even their skin, their texture, their color, their luster, enhance their overall appearance and vitality. And internally, with our team approach, we can improve their physical, mental, and emotional well-being, adjust the organs, meridians, and other systemic imbalance. And this is what's really important and the beauty of our medicine, because what we see is that the short-term results can be seen after a single treatment. Lasting results, you'll need to have a series of treatments, but you can actually maintain those results with maintenance. And we say maintenance is monthly, approximately monthly. But what's really interesting to me is the deeper conversation. So remembering that our medicine, we treat the physical, the emotional, and the spiritual. So when people come in, particularly when they're in their late 40s, 50s, and even early 60s, there's something else going on. And particularly among patients who have maybe not a great self-esteem or don't feel good about who they are as a person, maybe don't feel like they've accomplished what they've wanted to accomplish in their life. And they're relying on their perception, their physical. So whether it be how they perceive themselves physically or how they perceive how other people perceive them. But the bottom line is they're relying on the surface rather than their internal sense of self. And when their physical appearance starts to change, it throws them into almost a midlife crisis. So they, whether they're feeling fear or anger, some even people feel angry or frustrated or upset or whatever it is, they are going through these experiences and feeling these emotions, and the emotions actually exacerbate the conditions that they're concerned about. So for example, if they have creasing between their forehead or across their eyebrow, and they're pissed or they're angry that they're getting these creases, well, that repressed emotion is just going to increase the depth of those creases. So it's kind of this revolving cycle that they get themselves into, kind of like going down the rabbit hole. So what's wonderful about our medicine is that we actually can start to make that change from the inside to the outside. And as we adjust the internal how am I and who am I condition, that alone will help to increase the changes on their face. The acupuncture, the physical, absolutely helps. And then we know that our medicine helps you to feel better about who you are. So we're really treating them on so many levels, the emotional level, the psychospiritual level, and the physical level as well. So I want to kind of pull this all together with a case study for you. So this is a man, let's give you some information. He's a 44-year-old male seeking acupuncture treatment for enhancing facial appearance. That is what he came in for, that he didn't care about anything else. He just wanted his appearance enhanced. And he was particularly dissatisfied with the creasing between his eyebrows and across his forehead. Now, this guy also has bilateral headaches, temporal headaches. He has other aches and pains, but really he just came in for his appearance. He has been dissatisfied with it for the past few years. His forehead creasing began 2 years ago and got worse. And he really didn't care about his headaches or his carpal tunnel syndrome or his asymptomatic mitral valve prolapse or his periodic lumbar pain. He just wanted to get his this fixed. So you can write in that, just the focus of that was he was frustrated and upset. And we kind of know from our Chinese medicine that the eyes is the liver area. And we learn in facial acupuncture study that creasing between the forehead and the eyes is related to liver qi and liver qi stagnation. So that's what we discussed with his PCM pattern diagnosis. We discussed liver qi, blood stagnation with congestion in the gallbladder meridian. His tongue was slightly red, narrow, scalloped edges, red tip, pulse was slightly full and rapid. So he really did exude symptoms of that liver qi and blood stagnation with congestion in the gallbladder meridian. So that was kind of the focus for me, was to harmonize that liver qi and blood, ease congestion in the gallbladder meridian, but also treating his underlying aging with the root pattern of disharmony, which was also to treat the kidneys and the spleen, and then to use motor points, acupoints, ashi points, and other points on the face to help make him feel better. So the treatment plan was 10 weekly acupuncture treatments. And the points that I used were points along the liver and the gallbladder channel, but also supplementing with kidney points and spleen points, stomach points, and again, moving the large intestine area and triple eater 5. And then I'll show you how I did that on the face. And I also love using auricular points as well. So I used auricular points for the face. They also put the base of the neck to treat his headaches, liver, gallbladder, Shenmen, and sympathetic and point zero. So all of those auricular points are really, really good for relieving congestion, tightness along the neck area, improving the headaches, and then also using points on the body to also address the headaches, the gallbladder, stagnation, up the spine for his low back pain, and then using face points. So with the face points, also the angle of insertion was important for me too. So when I talk about this angle of insertion, what I'm referring to is the degrees relative to the skin. So 45 degrees relative to the surface of the skin is kind of like this, as the arrow is on the bottom. And so when I needle at a 45 degree angle, I'm actually needling into the muscle area, 90 degrees straight into the meridian and the acupuncture points on the cheek, 45 degrees into the muscle area. So the corrugator, which is what's creasing, you can actually see the corrugator muscle is right in here. You can actually see how tight and protruding it is. So needling into that corrugator muscle right into the muscle area. So that's at a 45 degree area. Stomach gate is a great, great point for the entire face. And then very shallow needling into the creasing across the forehead, either with intradermal needling or just taking a 1/2 inch serum needle, just opening the creasing and just sliding it right across the frontalis area. And then, so here's his before and after. So as you can see from his before and after, the corrugators, what he wanted, the corrugators, that frontalis area are really much better. But in 10 sessions, we haven't really resolved this, which is the underlying condition of kind of being frustrated with your life and may or may not feeling like you've accomplished what you want in your life. So obviously, he at some point got that there's a lot more to this than just my forehead and between my eyebrows. And I think it really started when he started feeling better about himself, and then realizing, well, maybe there's more to it, and maybe I need to address underlying levels of what's going on in my life. And so he did continue after the 10 treatments. He continued, and he really got a lot out of this on multiple levels. And again, that's the beauty of our medicine. So this was fairly straightforward, working with a specific area, some health issues, nothing major, but really taking into what he comes in for and what you treat, and then addressing what's underneath. And that's nice too, because some people will actually come in the other way around. They'll come in for their back pain. They'll come in for their headaches. And then you talk to them about their face, and they're like, oh yeah, sure. Let's, these are bothering me. These have been bothering me. And then you can clear them all up. So no matter which door they come into, whether it's appearance or health, you can help to resolve both. This next woman, she is a 32-year-old female, and she has a very different kind of history. When she was 24, she developed undiagnosed complications from Lyme disease. So for stage 1 of Lyme's disease didn't show up, the target, the aches and pains. She went right into the second stage of neurological weakness, facial paralysis, visual disturbance, fever, stiff neck, and severe headaches. She was very ill and almost bedbound for 6 years. 2 years later, when she came to me, she had slight facial asymmetry from the neurological weakness and facial paralysis. She still had severe headaches, neck stiffness, and hypersomnia. She is an attorney because of her condition. She needed to work from home, which was fine. And she definitely cleaned up her diet, but she felt like she missed her 20s and she was not going to miss her 30s. So to her detriment, she loved to socialize and party with her friends. So we had a little bit of work to do, but I also was sympathetic to her feeling like she really missed out on a very important time period and just did not want to miss it again. So there is a kind of a give and take between us, which seems to have worked out. Also, part of her condition, which is the underlying heat, is premenstrual acne. And she had tried everything to get rid of that acne. And they were deep cysts that occurred right before her period. So we worked with that as well. So her primary concerns were her face, facial asymmetry, frown lines, facial puffiness, lack of facial contour, skin sagging, nasolabial fold, hormonal acne. And then she also was more interested in resolving the headaches, the stiffness, and the hypersomnia. This is another thing I'll tell you about that. So you can actually see this bulging of puffiness along her jawline, flattening in this area, the zygomatic area, a little bit of redness and irritation. She also, hypersomnia, she would sleep like you would not believe. She could sleep 15, 16 hours a day and wake up and still be tired. So we had a lot to do. We had a lot to do with her. Her condition of that, the Lyme's disease, is known in our world as Goose syndrome. And Goose syndrome really stands for a complex chronic infection and inflammatory condition. She had a lot of inflammation. So we treated her by improving. She had a lot of deficiency of qi blood, yin and yang. Her pulse was thready, deep, thin, and weak. And she had a very pale, puffy tongue that had a slight yellow coat with scallops and a red quivering tip. So with treatment, we would rebuild, restore. There's a lot of restoration, rebuilding, restoring kidney, blood, yin and yang, nourishing kidney, qi, yin, yang, and jing, resolving that liver, qi, and blood stagnation, and from deficiency and general stagnation, calming the shen and eliminating that internal wind and pathogen. Again, choosing points on the body to treat the underlying condition, which is the Goose syndrome, using basic points. I tend to use very basic, simple points. So treating the kidney, the liver, spleen, gallbladder, stomach, the heat in the skin from that resorted to the breakouts in her skin right before her period, and taking out some of the heat in the stomach and gallbladder, large intestine for 10, sometimes 11, depending upon what was going on. And then triple heater 5, Ren 4, 6, and pericardium 6. We'll go over some points, again, using auricular points similar to what we used with the other patient, but adding the master cerebral point and some of the anatomical points, kidney, spleen, liver, depending upon where she was in her cycle. This was much more than 10 treatments. She probably came in for about 30 or 40, but the next slide is really, slides I'll show you is what we did for the first 10 treatments, focusing on her skin and her muscle tone. So I used a number of points. Now, these points, I would not use them all at once. I tend to be a very efficient needler. So if I use 7 or 8 points on each side on her face, that's a lot. And if I use maybe 10 points, 20 points at the most on her body, that's a lot. So I am not a big needler. What I try to do is take into consideration what's going on the from a biomedical perspective, biologically, what's going on, where is she from a team perspective, and putting the information together and getting kind of maximum efficiency out of each needle that I use. So some of my favorite points are gallbladder 14 for softening the frontalis area, but it also is the corrugator muscle that starts at bladder 2 and goes to gallbladder 14. By needling gallbladder 14, you can affect both the frontalis area, all the muscles across the forehead, as well as the ones between the eyebrows. Yintang, great point for relaxation, and for her in general, it's just a beautiful point. Gallbladder points around the ear to actually lift the cheek area. Points in the cheek to, again, lift up. Stomach 6 is a great point for this pouching that occurs from actually, it's the spleen, from muscle fullness and weakness. Great extra points in front of the ear, one to lateral to CV24, REN24, and then underneath the neck, there's a great points that actually lifts the entire neck area. And here's her before and after picture from 10 treatments. So you can actually see a huge difference in the cheek area and the lifting of her cheek area from the acupuncture point. But again, you can also see the redness and puffiness under her eyes. That is a much deeper problem. So although we made a huge improvement and she was extraordinarily happy about her changes, we kept going, and she probably came for another 30 or 40 treatments. We were able to make a huge improvement. Also, I don't know if you can see here in her forehead, it's much more relaxed, not as stressed, and so softening of the forehead area as well. So again, what I love about what I do is I can treat my patients from the interior and the exterior on both the physical, the emotional, and the spiritual levels, which I think is wonderful. And I love that my patients come out feeling not just more healthier and happier looking about their physical appearance, but about who they are as a person as well. To me, that's extraordinarily satisfying. So for the purpose of this lecture, let's just look at some before and after photos so that you can see what can be achieved. So this is the upper third. You can see creasing across the forehead area. And then with her treatments and between the eyebrows. So with treatments, we treated a lot more than just her forehead. But we can see the changes in the softening of the forehead area, softening in the creasing between the eyebrow. And just, again, for her, she had a lot of liver qi stagnation, also headaches. So we were able to resolve a lot of that as well. And in addition to it also helped her to clear her thinking process. So when you have a lot of stagnation and tightness at the back of your neck, and they also put in the gallbladder 20 area, it kind of gives you cloudy thinking. So not only were we able to make improvements in her face and her appearance, we were able to clear her headaches and help her to think more clearly, which she was very happy about. This one is, we're going to look at first the lower third. This is 6 treatments, and you can actually see a change in the jaw area. You can see in the more targeted lifting in the area, tightening of the neck area, softening of this area. And I'm going to show you what it looks like on a fill scale. So here you see, it's not just, we actually treated her neck in this, treated a lot of neck points. So by treating her neck, and there's a band of muscles called the platysma muscles. They start at the base of the clavicle, top of the clavicle, scoop up and attach to the corner of the mouth. When these muscles are very tight, they pull down on all of the muscles of the lower aspect of the mouth area, the lower third. So by releasing the muscles of the neck, I was actually able to lift the pressure off of these lower face muscles and start to lift the corner of the mouth, create a more definition in the jaw area, and actually tighten her neck. And when you do that, remember the weight being here starts to shift up here. So actually you can see the change, more pronounced cheekbones and more lifted appearance which that also helps in the eye area. So you can actually see this slight hooding of the eyes, tightening in here. You can't see the top part, but her eyes are more open. Her cheeks are more lifted. Her face is more sculpted. Her jawline is cleaner, and her neck is tighter. And here's another one. This is a beautiful picture of jawline changes. This is before the first one on top, after the 5th treatment, and then at the 10th treatment, before the 10th treatment. And there's just a significant change in terms of the definition of the jawline. And actually you can, I don't know if you can see this, but if you look right in here, this is tightening of the platysma muscles. Again, imagine a broad band of muscles that run from your clavicle to the corner of the mouth. They're huge, and they are just tightening and pulling down on the lower aspect of the jaw. So if you release those muscles of the neck, and then also the modiolus, which is right here, which connects all of the mid-face muscles and the muscles, the orbicularis oris, the muscles around the mouth. So if you lift this, take the pressure off, you can just clean up that jaw area very, very quickly. You can see huge changes in 1, 5, and 10 treatments. This is one treatment. So this area, remember we talked about a point that's one soon lateral to CB24. It's right here. There are 3 sets of muscles in the lower face, the triangularis, which you can actually see right here. And then there's another muscle right in here. These are both depressed. They pull down the corner of the mouth. And then the mentalis lifts the center. So as we age, this gets lifted, the chin starts to come up and create that creasing underneath the chin area. And these pull down. So in one treatment, this is the beginning of the change for her. Now, obviously, it's one treatment. She needs to come in more, which she did, but you can actually start to see visible changes that can occur in one treatment. And we talked about acupuncture stimulates the ability to improve collagen in the cheek and the face. Most collagen and elastin breakdown begins here in the cheek area, lower cheek, around the sides of the mouth. And then we were able to make a significant improvement there. And this is a perfect example of kidney yang deficiency. You can just see puffiness, swelling around her eyes, whole face, a lot of inflammation in her face. So I actually did a little facial gua sha, some face cupping along with the acupuncture treatments, and just cleared up this whole thing. Big change around her eyes, less hooding in the eyes, less puffiness under the eyes, and a significant change in the mid face area and the lower face area as well. So the takeaway is that team facial acupuncture treatments, we're using a whole systems approach towards aging and the treatment of the aging face. Facial concerns, wrinkles, sagging skin, muscle tone, skin discoloration, etc., are really just symptoms of an underlying pattern of disharmony. And the anatomical and biomedical morphological changes of the aging face affect treatment strategies and needle placement. Effective results for treatment reside in the understanding of the relationship between biomedicine and team. And when performed properly, you can really get significant, long-lasting results that people love. So I do offer a 100-hour training program. It's myself and other leaders in the field of facial acupuncture offering classes. Half of them are virtual online, and then the other half are hands-on clinical mentorship. And so the next one is coming up on January 10th, 2021. Here's the link if you're more interested. If you have any questions at all, you can contact me here, and then you can also follow what's going on in Instagram. So thank you. I'm happy to share this with you and open for questions.
Shellie, we have questions, and I have to say, I'm blown away. Like I've heard it. I don't do cosmetic acupuncture, but I was like, pretty wow. So much so, a few people said, "Hey, how can I learn from Shellie? Can she come on healthy?" So Shellie has her big program. But Shellie, after this, let's chat. Let's get more on this because I'm like, that was great, and I just love the way you teach. Thank you for putting that together. There are a few questions for you. One of them is, how often were the 30 treatments spanned out?
Weekly.
Okay. Do you use electroacupuncture on the face?
I do. I use it, but I don't use TENS, it's because remember that the muscles of the face, those mimetic muscles, remember how flat they are. If you were to use something strong, you would actually fatigue them. So I use subsensory microcurrent. That's 1/100,000th times weaker than a TENS machine. So it really it syncs with our natural vibration. So by stimulating it on a vibratory level, it encourages the muscles to do what they need to do rather than working them. So it's not a facial workout, it's a vibration.
Excellent. If people have connective, If connective tissue disorders, if people have connective tissue disorder, does acupuncture have any negative impact from multiple needlings?
Connective tissue disorder in what sense? There's multiple types of connective tissue disorders. If that person wants to come in and ask me directly, do you want to do that?
Yeah. Do you want to unmic yourself? Your team, can we make sure they can unmic themselves? And if that person wants to do that, and while we're getting ready for that, What's your favorite needle brand that you use on the face and what size?
Okay, so I loved Siren needles, but they're a little expensive. So there's another one called DBC. They're from Hong Kong, and they're equally good. But I tend to be a very efficient and shallow needler. So I use 1/2-inch needles on the face, and then I use 1 or 1.5 inches on the body, and thin, like 40 gauge, which is they're thin, not thin enough to break, but just to be flexible so that I can and actually get my hand in there and just kind of work in the tissue. So, and also remembering that I needle on multiple levels. If I am needling at a 90-degree angle, I might use a 38 gauge or a 40 gauge. But if I'm doing shallow insertion, I'm going to use a 40 gauge needle, sometimes even a 42, depending upon the plumpness of the face and the age of the person, because older people have drier skin. Drier skin is actually harder to needle. So you have to use actually a little bit of a thicker needle with an aging, drier, more leathery skin than you do with the younger skin.
Have you been using photobiomodulation, like the red light therapy and blue light therapy?
I love it. Yes, I do. Yes.
Okay. Do you give your clients homework like self-treatment with gua sha, facial cupping, and the like, or any devices that you recommend to send them home with?
I certainly recommend skincare regimes, and I do usually with the 10 treatments. If they're coming weekly, I want to know how long each treatment is lasting. So even though it's 10 weekly treatments, if someone is only holding the benefits of their treatment for 3 days, I need to rethink my treatment strategy a little bit. So I don't always give them homework or assignments during their treatments unless they are having allergies or something like that, where they're constantly getting inflamed. And in that situation, I might give them a little gua sha tool and kind of instruct them to do gua sha. Now, I just want to say something about facial gua sha. Facial gua sha isn't really gua sha, because gua sha, the intention and the effectiveness in gua sha is to create petechiae. You don't want to create petechiae on the face. So when I say gua sha, it's almost like shonishin for those of you who know more about pediatric acupuncture. This is more like facial massage with a gua sha tool than actually performing gua sha.
Perfect.
Okay.
Back to that connective tissue. So
Sure.
if people have connective tissue disorder, does acupuncture have any negative impact from multiple needling? Connective tissue disorder like weak muscle tone and scarring easily post any injury?
No, acupuncture will help it. Because remember, as we age, the muscles attenuate, drier, stiffer, shorter, they lose their amplitude, and the tissue loses their moisture content. So acupuncture is going to actually help the muscles and the tissue that surrounds it.
Is there anybody that's not really suitable for facial acupuncture, like they don't respond well, like smokers, etc.?
More along the lines of people who are really, really weak. And like the woman, the case study, that woman, I probably would have recommended, if I didn't know that she was going to come in for more, or her commitment was longer term, I would have had her come in for acupuncture before, body acupuncture before facial acupuncture, because I would have wanted to build her a little bit more, make her a little stronger, so that the acupuncture treatments for her, specifically her face, would have lasted longer.
We're going to give Shellie our TLC and open up our mics. I just want to remind you guys that if you're looking to watch this replay, it'll be up for 48 hours on the resource page on Healthy Seminars. Just scroll down past the calendar and you'll find it here. So this is where the replay will be available for you for 48 hours to watch. Check out our Healthy Seminars upcoming live webinars. You can save on those early bird discounts. And Shellie, I'll call you after we're done here. This was fantastic. If you guys would like, this is part of the Community Unity Immunity series that we like to undo our mics. So unmute and send your appreciation, your gratitude for Shellie for putting that together, sharing with us, and then also say hello to your loved ones that you see in the room here together. Thank you, Shellie, guys.
Thank you.
Thank you, Shellie. That was great.
Thank you, Shellie.
Thank you.
Thank you.
Yay. Very much. Thank you.
Love you all. Thank you.
Thank you.
Great. All right. Thank you all for joining us today. We really appreciate that you came and joined. Thank you for your questions. Shellie, thank you for putting this presentation together. Sandra and Lorianne, thank you for making things work so simple. I appreciate everybody that's involved. Love my community. Until next time, take great care, everybody.
Thank you, everyone. Appreciate it.
Thank you.